the optimization zone is when we really start to get some solid identification and susceptibility test data for these patients. And this is when we really see a lot of impact to patient care.
After the initiation zone, we are entering in the optimization zone, where every result could trigger an adaptation of the treatment, and where we are looking at identification. The result is giving you the name of the bug responsible of the pathology of the disease.
In that identification area, still in the optimization zone, we have tools like Vitek MS Prime, which is our MALDI-TOF system. That's been demonstrated widely to really improve the turnaround time for organism identification. So we get identifications of organisms much faster than our standard biochemical methods. And that's really important because as soon as a clinician knows what's causing an infection, the sooner they can modify therapy appropriately and effectively manage that patient.
It's important for it to be timely so we can narrow broad spectrum therapy and bring it to maybe one or fewer agents that were initiated, de-escalating therapy from 3 or 4 drug regimen down to 1, and ultimately reducing the exposure for drug-related toxicity and increasing the efficacy using specific antimicrobial agents. Ultimately, you really want to know how susceptible are these microorganisms going from the initiation phase into the optimization phase. And once we can test the susceptibilities with our AST testing with the Vitek 2, then you can really optimize antimicrobial regimens and give the patient the right dose, design the regimen for it to be the correct duration as well.
So the antibiotic susceptibility test results provided really fast by Vitek Reveal, or by Vitek 2 e-test, also some additional testing like Rapid Carba NP. But also if we take back the BCID2 panel, it's also providing additional results, but more on the genotypic part. So we are looking at the genes, resistant genes present in that specific bacteria identified, triggering so a second layer of stewardship based on every susceptibility result or resistance result given for specific antibiotics.
If we did susceptibility testing on that organism and got those data from an assay such as the Vitek 2 instrument, those data could then be pulled up into the Clarion data suite and could be coalesced and analyzed appropriately for an antibiogram for that hospital, which is much more effective than laboratorians trying to do that all by hand. That also allows various partners across the hospital to use those data for epidemiologic purposes, infection prevention, monitoring, reporting, things like that.
The identification and the AST component in the optimization zone is crucial in the patient journey, going from the empiric regimen that were started in the initiation zone down to the optimization zone.
We are providing earlier results to the clinicians, so we can start again earlier adaptation of these treatments, result of identification and final results of phenotypic antimicrobial susceptibility testing results, allowing a targeted treatment far better than before, and so giving more chances to patients to be treated faster with the right antibiotic and to have a positive outcome.